Hi guys, my name is Michaela. I am currently 30 weeks pregnant with my 6th pregnancy and 4th baby. I am having a baby boy. I have 3 children, ages 6, 3, and 21 months. Today I wanted to share with you kind of what to expect when you are breastfeeding, whether it's your first time or you're more experienced and maybe you're just looking for more information about breastfeeding according to other people's experiences. These are going to be my own personal experience. I am not an expert and it was very difficult for me, very painful at the beginning. So I wanted to kind of give you guys some more information about what to expect about it. Because with my first son, I really went into it kind of naive. I watched a few random YouTube videos that were just like very informative step-by-step guides about breastfeeding. I read like a pamphlet that the hospital gave me and watched a few random videos and stuff. And I went into it thinking that breastfeeding is such a natural thing, like it's going to be easy. I'm gonna breastfeed my baby and that's gonna be it. You know, I'll put boob in the baby's mouth, feed the baby will let me know when they're hungry, and like it'll be good, you know? And that was totally not how it was at all. I will start off with my first breastfeeding experience. This might be something that other women experience, so I wanted to mention this first. My milk did not come in with my first son, and I did not know about it because I didn't have enough experience or knowledge to realize that he was eating and getting enough. So I did have colostrum and my boobs just never produced milk though. I wasn't aware about how to use a breast pump. I wasn't able to get a single thing out with a breast pump. And my son ended up getting very dehydrated, and we also found out that he had like a dairy and wheat allergy. I ended up throwing in the towel when he was about 2 weeks old, and we started formula feeding. So I wanted to point out first off that even though this is a breastfeeding video, if you, for whatever reason, there's some sort of a medical issue going on, or you're just like me and your milk didn't come in for whatever reason, I'm pretty sure looking back at it now, he had a very severe lip tie and a small tongue tie, and we had no latch basically. That is why my milk did not come in, and I just wasn't aware about it. It is okay to formula feed if you need to. Your baby getting fed is the best way to go about things. At that point, I saw someone to help with breastfeeding and my milk never came in just because it was kind of past the point of return and we weren't able to get my milk to come in. I'm not exactly sure why, because sometimes people can make themselves induce lactation. That wasn't the case for me. So I wanted to let you know that feeding your baby is the most important thing. Don't beat yourself up about it if you end up needing to formula feed for any reason. Now, saying that though, if you have interest in breastfeeding, you want to breastfeed, you are looking up all this information, you really need to keep a positive outlook, because I'm going to tell you right now, this is hard. It is very hard. It was hard for at least 6 months with both of my children that I successfully breastfed with. We did have a lot of pain, bleeding nipples, cracked nipples, trouble latching, tongue ties, lip ties, the whole shebang, not taking bottles, wanting the bottle more, all the problems that you could think of, thrush, Raynaud's. I've experienced it and I will go into in this video. And there were so many times when I just wanted to throw in the towel and say, I think I just want to get formula. It's going to be so much easier because this is so painful. This is so difficult. I'm not getting any sleep. The baby's not getting any sleep. I feel like I'm not making enough. These are kind of all the things that were going through my head. Even though I had experience with my daughter, the same things went through my head with my son. And I'm expecting the same things to go through my head once I have this baby as well. So I want to let you know, you will and most likely will experience all of these negative thoughts and emotions and feelings and stresses that happen that go with breastfeeding, because it is not a natural thing that we just know how to do. We kind of have to teach ourselves how to do it, and we have to help the baby figure out how to do it as well. So it's not mostly, now there are those random people that just put the boob in the baby's mouth and they're good, but for most women that is not how it is at all, and so you really have to stick with it. So if you're wanting to breastfeed, I would tell you to not keep formula in your house and to make sure that you have a really good support system. Make sure that you let the hospital know or your midwife know that you are wanting to breastfeed. Make sure you set up an appointment to see a lactation consultant. You want to set that appointment up when you're pregnant or after you have your baby. And if you are not being induced or anything, you'll probably have to make that appointment once you have your babies, so you don't exactly know when your baby's going to be born. But you want to have that appointment set up so that you see someone to help you breastfeed within about at least 24 to 48 hours after you have that baby. And yes, it is very difficult to get in to do appointments when you are that fresh after having a baby. Hopefully you either have one at your hospital or there's one that could come to you. Under most insurances that I've had, it actually covers a lactation consultant to come into your home too, if you could find one that accepts your insurance. There are those beautiful lactation consultants that will do house calls. And I'm just telling you that right now because even after you watch this video, you will experience things that will really frustrate you even after knowing about them. Now, I know that was a very long intro, so we're going to get into it now. The first thing that I experience when I first have a baby is feeling like I'm not making enough. So you have, and by the way, I'm not like going to blank anything out of here or give any warnings of anything. This is definitely a TMI video. We're talking about boobs and nipples and whatnot. You're just gonna expect it. So within the first few days, if you are struggling in any way, you will most likely have cracked nipples, bleeding nipples, and your baby might be extremely fussy. And it does not mean that you are not making enough. You most likely either don't have a good latch going on, either it's not deep enough, or the baby maybe has some sort of a lip or tongue tie. I would not recommend having their pediatrician to look over this. You would have to get a referral to get it better looked at by like an ENT, or even some specialty dentists will look at it too. Most pediatric, like your pediatrician for your or for your baby, normally doesn't have like the most advanced knowledge about this kind of stuff, and sometimes it could be missed. Same thing with like midwives, sometimes it could just be missed. So I would definitely take your baby in to see someone. Lactation consultants sometimes have a lot better knowledge about what those look like and can help you evaluate that, which is why it's also really important to get in right away to see a lactation consultant. But you will have cracked, bleeding nipples. It'll be very difficult the first few days. I literally cry for the first 3 or 4 days that I breastfeed. And it's just, even though I've breastfed before, it's very painful at first. It is definitely hard to get used to. I remember with all of my babies breastfeeding, as soon as they latch on, it's like the worst freaking pain ever. You're like clenching up, you're feeling like there's so much pain there, your nipples on fire, you feel like you just want to cry. I did cry a lot the first 2 weeks probably when I would breastfeed with both of my babies. And it's difficult, and you just got to keep going with it, because I promise once your nipples heal, it will not hurt that bad. Now, it may still hurt. You may still have to get used to it for a few months, but it will get better. Like, I promise you, it will get better. So with that being said, though, when you do have those cracked, bleeding nipples, it is really important to try to give your nipples a break. If they are so traumatized, you don't want to risk any long-term damage in your nipples or your areola. It is perfectly okay to take a break and to pump, and then to try to feed that pumped milk to the baby. I personally like either syringe feeding or cut feeding. Cut feeding, you'll have to look at a video of that, but basically just put it in like a little, almost like a medicine cup, and baby only needs such a tiny amount at first. But they basically lick it out, and it looks like they're drinking like a cat, but they drink it, and it helps prevent nipple confusion. I would definitely do that if you need to give your nipples a break to pump. You don't want to put the all the fancy nipple balms and creams that you find on the market. They are not going to let your nipples breathe. They are not going to let them heal. They don't have like antibiotic ointments inside of them. Literally the best thing that you could put on your nipples during that time is coconut oil to keep them from sticking if they are bleeding. You don't want them to be sticking to your breast pads and to your shirt and everything. I'd use coconut oil, and right after you're done feeding, put on like a triple antibiotic ointment on them. And that will really help speed up the healing process. The other things like the lanolin nipple creams and Medela nipple creams and stuff like that are just too thick and cakey, and they aren't going to really let your nipples breathe, and they aren't going to help them heal either. I'm not too big of a fan of either of those nipple creams at all, but my favorite is definitely coconut oil. Also, when you are pumping, if you're having pain when you are pumping, put a bunch of coconut oil on your boob. You could put it on the inside of the flange so that there's no friction with your nipple going in and out of the flange. Make sure you have the correct flange size. You could look at pictures on like Google or on Facebook forums to see how to size your boob for your flange. I have always had two different flanges. I don't know why. This one's like an elastic nipple, and then this one's like a regular one. So I have to size up on this one, and then like this one's normal. But make sure you have your correct flange sizes, and then it won't hurt when you're pumping. Also, you don't need to turn up your speed on your pump to the highest setting or anything like that. You do it to what it's most comfortable for you in order for you to pump. You may not get like hardly anything or anything at all. You might only get a few drops when you first start pumping, and that is perfectly okay. That's the second thing that I want to mention, is that pumping is not recommended unless you need to. And when you do pump, don't think of it as how much your baby is getting, because your baby is a lot more efficient at getting milk out of your boobs. And if they just ate even an hour ago, you're probably not going to get as much out as you would have, because they've already eaten part of that. And also the baby is better at getting it out of your boob. So don't think of it as like an indication of your supply. You might not be able to pump anything at all. It does not mean that you don't have a good breast milk supply. It just happens. And it's perfectly okay to not produce anything when you're pumping. The best way to figure out how much your baby is getting is by doing a weighted feed, and to see how many wet and poopy diapers your baby has. I also would like to point out that if your baby has already gotten out meconium, your baby might not poop for almost 2 weeks. And that does not mean that you are not producing breast milk. If you have enough potty diapers during the daytime, that baby is growing, it is perfectly okay to not have any poopy diapers whatsoever, because your breast milk is like liquid gold and there's not a lot of waste that comes out from breast milk. Now, this isn't everyone's experience. Your baby could literally poop 20 times a day when they breastfeed, and it happens. Sometimes babies just poop a lot when they breastfeed, and sometimes you get a baby that just never poops and then they poop it all on one day. So just go into breastfeeding realizing that their poop is not like a good indication of how much they are getting. You really want to do those weighted feeds with like a lactation consultant to figure out how much your baby is actually getting if you are truly worried about your breast milk supply. Now, coming from that, with already talked about the cracked nipples and those first few days, I would like to point out that sometimes your breast milk just doesn't come in for a few days. You don't need to supplement. Your colostrum is all the baby needs. And colostrum is very thick. You probably won't get any of it out into a pump at all. And it's difficult to tell except for how much your baby is peeing by how much colostrum you're making. So the baby is getting everything they need with the colostrum. Your boobs will start to feel rock hard, and then eventually your breast milk will come in and that relief will start coming in. Now, when your breast milk does come in, which could take a few days, some women I've even heard up to like 5 days that their breast milk hasn't come in. So it really just depends on your baby. It's really triggered by when the placenta detaches from the uterus and your body starts producing the hormones to make the breast milk. So don't be too concerned about it. But if your boobs all of a sudden become so engorged, you normally know. Now, when I would breastfeed and my breast milk finally came in, like the next 2 days after that, I was like a shower head. Like, whenever I would change, whenever I would lay down in bed, like whenever I would do anything, showering, you hear the baby cry, literally at any second of the day, my boobs would just spray milk, like all the time. I would soak shirts, soak breast pads. You might go through a lot of breast pads those first few days. Now, I highly recommend buying 2 or 3 packs of like reusable breast pads, because it'll really help to cut down on like waste for breast pads, because they could be very expensive and you will go through a lot of them in like those first few weeks to first few months. If you were anything like myself, I had to change them frequently throughout the day. I had to change them frequently throughout the night. Like, I would easily go through a whole set of breast pads in like a 12-hour period. So if you don't want to have to deal with the laundry of that, I really recommend just getting that big, huge box that's like 100 count of breast pads and using those. You want to make sure that you are changing your nursing tops often, and you are changing your breast pads often, and you are taking hot showers. It is so hard to get in a hot shower with a newborn, but it is so important that you are getting in that shower. You're letting the water hit your boobs, or you're massaging your boobs to help get the milk flowing, because your baby is not eating all that milk yet. They just aren't. And it doesn't mean that you need to pump, because pumping could tell your body that you need to keep making that, and that could cause a lot of pain inside of your breastfeeding journey for several months if you are an oversupplier, and you will have to continue pumping that whole time. I don't recommend pumping unless you need to. To that shower, get some of the milk out, wash your boobs really good with antibacterial soap. You want to make sure that your boobs are always staying very clean, because otherwise, especially if you have cracked nipples, you could get mastitis very easily. Bacteria could get into it from not changing your breast pads or your shirt frequently enough, or they could happen from clogs. So you really want to make sure that you are changing those often. The heat from the shower will really help your boobs feel better. And you don't want to end up getting mastitis. Mastitis can get very serious very fast. It is an infection in your breast tissue and your breast milk, and it can make you go septic like very fast. So when I'm meaning very fast, I mean like within a day. Like you could end up in the emergency room needing to have a transfusion and like all this other crazy stuff within like 2 days of having this infection start. So I've had to go to the emergency room a few times from mastitis, and it is just not fun. You need to get antibiotics for it if you already have a fever for it. It's extremely important that you get in to see your doctor right away. If your doctor can't see you, you need to go to an urgent care or you need to go to the emergency room so that you could get antibiotics. You might start to feel really like pain. You might start to feel some pain in part of your breast. It might feel very hot to the touch. You might see some veininess going on that shouldn't be there. They could be swollen. It'll make you feel very tired. You will feel all of a sudden like you have the flu, and you'll most likely end up with a fever very quickly. Like this could happen within a few hours. So I recommend that you get checked out right away. That way you could get it taken care of. Now, once you have gotten past those first few days, now comes the part where you're finally getting the hang of how to hold your baby and your nipples aren't hurting as bad. Hopefully you've seen a lactation consultant so that you could get a good latch and all those nipple pains could start going away. You may start to feel other problems. Myself, I personally have Raynaud's. It causes my nipples to get very veiny, like they get thrombosed, and it's really important that I keep my boobs warm so that doesn't happen, because it will cause sharp pains inside your nipple and through your boob that sometimes feels like you might have thrush, but it's not thrush. It's just unfortunately a condition that can't be cured with like anything. Even if you have never had Raynaud's before, you could get Raynaud's in your boob when you're breastfeeding. So in order to get that diagnosed, you would definitely have to see a lactation consultant and explain the symptoms that's going on, especially if you notice that like thrombosed nipple where you have these veins that are very poofy inside of your areola. That's like a telltale sign of having Raynaud's. So that is an issue, unfortunately, can't be taken care of. You will have pain almost the whole time that you're breastfeeding until around 6 months or so. Then I feel like it starts to subside. But it's important to just stay positive about it. It's not as an extreme pain as it gets further along. I feel like it slowly gets less and less and less. Now, another issue that could happen is thrush. You could get thrush in your boobs and your baby might not have symptoms of thrush. It's really important that if you are treated for thrush, that your baby gets treated for thrush, and that you end up sanitizing all your shirts and whatnot, any nipples, bottles, whatever that you have. Get them all sanitized, because thrush is no joke. It could stay with you for weeks. I would say 99% of the time, any sort of creams that they give the baby or medicines for their mouth just don't work. They just don't. I've had a doctor prescribe gentian violet, and that I feel like is the most effective way to get rid of thrush in an infant. And it will help if you put it on your nipples. You can put it on the inside of the baby's mouth. Now, I am not a professional. There are a lot of people who are against using gentian violet. They say it's carcinogenic, so you would have to really look into that for yourself. But if you have thrush that's just not going away after weeks and weeks and weeks, it might be something that you want to consider. You also could use Vinegar Soaks on your boobs. start taking a probiotic. It's also really important that as soon as you start your breastfeeding journey that you're giving your baby a probiotic, and you could either do that through like drops, through what, like an infant probiotic, or the coconut oil putting on your nipple also helps the baby. That doesn't harm the baby to have coconut oil on your nipples, and it'll help your nipples not dry out or have any cracks or anything like that in it. But you can take some like probiotic powder I've seen moms do and put it like around on their nipple, and then it transfers to the baby that way. Of course, ask their pediatrician because you want to make sure that it's like a safe amount for the baby with whatever probiotic you are using. So that's very important as well. Now, you will probably have doubts about how much breast milk you are making for weeks. And even if you've seen a lactation consultant, babies cluster feed. And by cluster feed, I mean that they might be on your boob for a whole entire hour and only be off your boob for 5 minutes, and then want to be on your boob for another hour for days, where you feel like you haven't taken your baby off the boob except to change their diaper. And that is true. It could happen. Your baby could start using you as a pacifier, cluster feeding. It's really important though that if your baby is wanting to suck, let your baby suck, because up until that 3-month mark, your baby is telling your body how much breast milk you need to make in order to keep it full. So you need to do that cluster feeding. Don't try to like use anything else or think that you need to push your baby further and further away from their feeds. Just feed on demand and make sure that you're feeding until they are full, you know, like they might be a little bit limp once they're full. Like you could kind of tell once they're getting full, they don't suck as hard, it's a little bit different. Make sure that your baby is completely satisfied every time that you're nursing them. And then even if they want to nurse again 20 minutes later, feed them again 20 minutes later. And that's how you will keep your breast milk supply up to your baby standard. Your baby will also go through growth spurts, and those growth spurts can make the baby very fussy, and they can make the baby suddenly ravenous. Even after the 6-week mark, your boobs might start feeling like they aren't as engorged, and you're finally starting to make what the baby was asking for. And then your baby goes through a growth spurt, and then all of a sudden they're so hungry and your boobs just feel empty. And I'm talking about like you feel like you can't get anything out of them. Trying to pump, you can't get anything. It does not mean that you don't have any milk. It just means that the baby is trying to ask for more. So let the baby ask for more, because no matter where you are in this like breastfeeding journey, if your baby wants more, give them more. Don't try to supplement, because those first few days it might seem like you're not making enough. The baby will be very fussy during those growth spurt periods. And yeah, your body is not making enough breast milk yet, but if you supplement with formula, then it's not going to. So if you want your body to keep up with your baby, you have to let your baby cluster feed. So every time that you have a growth spurt and your boobs start feeling like they don't have anything inside of it, don't worry. You just need to keep feeding your baby, and then eventually your breast milk will regulate again. And this will happen frequently throughout like the growth spurt stages. Now, heading up to about 6 weeks, you will start seeing what is called the witching hour. Now, the witching hour, I feel like makes everyone feel like they are a bad mom. It really gets to you emotionally. You will have this period for, no joke, about an hour long where your baby screams. The baby doesn't want to eat. It seems like the baby is starving. You try to feed the baby and it seems like they're not getting anything, and so they get angry and they start screaming, and it just goes in like this cycle where they seem like they're really fussy. So you try to latch them and it doesn't work, and it makes you feel like you're not making enough breast milk, and that's why they're getting fussy, because they're not getting anything. But no, I promise you, you are still probably making enough. It's just that the baby is going through this fussy period, and it lasts for about an hour every night, might last for a few weeks, where your baby will just scream, and it will have nothing to do with your breast milk supply. And you really just have to pull through it and rock your baby, cuddle your baby. Your baby probably won't be soothed by like almost anything, and that's okay. I just wanted to warn you about it, because a lot of times I feel like moms feel like their babies are starving during that time period, and they're not. Like, I promise you, your baby is not starving during that. They might seem like they're starving because of the cues that they're showing. They're probably trying to show that they're hungry, and then you try to feed them and it's not working, and then they get even fussier. It kind of seems like they're just not getting enough, and that's why they're getting upset. But no, like, regardless of whether you're breastfeeding them or formula feeding, babies go through this time, because I've experienced it. So just keep your head up and realize that this period of time, your baby will just be fussy, and it will just happen for a few weeks. You just got to pull through it. Now that we're getting a little bit further, your breast milk is probably regulated at this point. You are going to, if you are like me, you might still feel pain. You might still feel discomfort. You might still feel like you're just not making enough breast milk. And it's really important until you're 6 months, if you really feel like you aren't making enough, but it's been confirmed by a lactation consultant, to just tell yourself, just keep feeding. Just keep feeding. Like, I will feed until this much longer to just get you over this hump, you know? Like, keep telling yourself, set a goal. Set short-term goals about when you want to stop breastfeeding, and it'll really help you achieve those goals so that you end up not giving up. Because before 6 months, you might want to give up all the time. I'm just letting you know. You might just want to throw in the towel. It might be really eating at you mentally, and if you end up deciding to throw in the towel, that's perfectly okay. Like, you can, if it's affecting your mental state that much, go ahead and you can formula feed. But if you are really wanting to breastfeed, don't. Just hold out, and you will eventually make it to this point where it's perfect. Like, I'm talking perfect. Easy. You whip your boob out in the middle of the night, feed your baby, didn't hurt at all, your baby gets full, they fall back asleep, and then, like, it's just so easy. Like, not making any bottles, just feed your baby wherever you're at. Like, it is a glorious thing. Once you've hit about 6 months, it'll start getting so easy. So I really encourage you to hold out. If you decide after 6 months that is just kind of where you want to throw in the towel, then that's of course what you want to do. But I really recommend waiting until that point, until you decide that, because it is like night and day. You will notice such a difference once you get to a certain point of your breastfeeding journey where it just feels like so natural, like what you would have expected it to feel like when you first wanted to start breastfeeding. And that is like your ultimate goal. Now, I know 6 months is a very long time, but once you have that other time period where you are breastfeeding, you know, some woman might only want to breastfeed for up until a year, but that's 6 months of bliss. Like, it is so easy to feed during that time. You don't have to worry about bottles or anything like that. So it is definitely worth it, even if you're only planning to breastfeed for a year, to really hold in until that 6 month period when it starts becoming easy. I wanted to mention a few other details that some women might not think about. Your nipple shape might determine how easy it is for you to breastfeed, whether your nipple is inverted, flat, or if it's sticking out more. It doesn't mean that it'll be like this the whole time that you're breastfeeding. If you need to use a nipple shield, then you could totally do it. Don't be scared, because I've used a nipple shield and I was able to take it away so easy, and it wasn't a big deal whatsoever after I took it away. But you need to keep in mind, if you're using a nipple shield, there is not the same milk transfer rate as there is without the nipple shield. So your baby will probably eat for longer periods of time, and you want to make sure that you are getting all of your milk out. So feed your baby often. If you needed to pump during that time using your nipple shield to supplement the baby with your pumped milk, then go ahead and do it, because otherwise your supply might not be as much as the baby actually needs, because it's going to take longer for the baby to get what it needs when using the nipple shield. So you don't want it to affect your supply. Try to not use it that long. If you need to, just keep that in mind, that in order for your baby to grow properly, a 20-minute feed for someone else is totally different for a 20-minute feed for a woman who's using a nipple shield. So just keep it in mind that you still need to supply your baby the same amount of milk that they would get without the shield, which is a lot different. And then eventually you'll be able to take it away, no problem, as long as you are keeping your supply up during that time. I also wanted to mention that pumping, although it is good for certain circumstances, like if you needed to supplement your milk, whether you're needing to use like an S&S system or you're using bottles, you need to go back to work or anything like that. If you are planning to just exclusively nurse and you aren't planning on going back to work anytime soon or anything like that, don't pump. Don't pump at all. I would use a Hakkah to catch milk. It's like a little silicone, it's like, I wouldn't really consider it a pump, but it definitely helps catch your letdown. You can put it on the opposite boob that you're nursing off of, and it'll help catch your milk. But otherwise, I wouldn't pump at all, because if you start making more than your baby needs, then it causes a lot of problems later on in your breastfeeding journey, where it just makes it really painful. So if you're engorged more than your baby eats, then you will stay engorged the whole time, and you just have to keep pumping, and it creates like this vicious cycle where every morning you have to pump, and then you have to pump in the afternoon and the night, and then you might have to pump in the middle of the night, and it gets really annoying, and it can actually cause a lot more pain than necessary when you are breastfeeding. So that's the last thing though that I would say to definitely just stay away from if you don't need to. If you are planning on going back to work, I would definitely say to pump from the beginning though, because you'll need to tell your body to make more milk in order to have it for later on when you decide to go back to work. It's not going to be as easy if your breast milk is already regulated and then you try to pump. You might not be able to get as much out through the pump as your baby was able to get out when just eating, and because pumps just aren't as efficient, and you might actually be making less using the pump than you were when you were actually feeding your baby, and it could kind of make it harder. You might feel like you need to end up supplementing. I would recommend just starting to pump early on to tell your body that you do need to make that extra milk. That way, when you are pumping, when you are going back to work, then you get the correct amount of milk that you need, and it's not just the amount that the baby needs to get out, because they're two totally different things. You will probably not be able to get out the same amount of breast milk that your baby was getting out. So that is the last thing that I wanted to say though. Thanks for watching. I hope you guys enjoyed the video. Just wanted to share my overall tips and kind of like a guide to sticking with breastfeeding and all the little nooks and crannies that you'll probably pop into once you are going through this experience. I hope that it kind of prepares you and that you are able to push through. It is very difficult, but I think overall it is so rewarding once you're able to actually do it. So you guys have a wonderful day, and I will talk to you later. Bye.